Hi, I'm Isabella, and today I will be talking about the physiology of the aqueous humour and its role in glaucoma, as well as how the XEN gel stent provides relief to patients suffering from certain forms of this disease. The aqueous humour is a thin and transparent liquid which gives the eye its shape and keeps it moist. It is constantly being removed through drainage canals and produced by the ciliary body, carrying nutrients to the eye and then removing waste products. The continuous production and removal maintains the intraocular pressure of the eye, otherwise known as the IOP, and is found in the anterior segment of the eye, just in front of the lens. The normal and healthy physiology of the aqueous humour keeps the intraocular pressure of the eye at a stable level, and it is the balance between the production and drainage of the aqueous humour that determines this level. In a healthy eye with a normal level of drainage, the intraocular pressure within the anterior chamber should sit between 10 to 21 millimeters of mercury. A decrease in this outward flow will result in a buildup of the aqueous humour, and thus will increase the intraocular pressure. It is this increase that causes a pressure buildup, which can damage the optic nerve, as seen in this image. To maintain the intraocular pressure, the ciliary body secretes the aqueous humour into the posterior segment of the eye, and it then flows through the surface of the lens, through the pupil, into the anterior segment. It then goes through the trabecular meshwork into the canal of Schlemm, where it flows through the scleral veins to leave the eye. This process of how the aqueous humour is removed from the anterior chamber is of importance, as the change in this outflow is what causes glaucoma. Glaucoma is a physiological disease which impacts the eyes and is caused by a blockage in the outflow of the aqueous humour, resulting in an increase of the intraocular pressure. It is this buildup of pressure that affects the optic nerve and can cause partial or total loss of vision that cannot be reversed. There are many different types of glaucoma, with the main two being open angle and angle closure. Here you can see the normal flow of the aqueous humour, and in the affected eye you can see where a blockage can occur and how this causes the pressure buildup. Angle closure glaucoma is a less common form of glaucoma and is caused by a sudden block of the drainage canals by the unnormal, closed or narrow angle between the iris and cornea, as the pupil has enlarged too much or too quickly, causing a sudden increase of the intraocular pressure. This condition is quick to develop, with sufferers having prominent symptoms such as severe eye pain, headache, nausea, vomiting, and has noticeable damage such as blurred vision. Due to these symptoms, open-angle glaucoma requires immediate medical attention to relieve them and prevent the permanent loss of vision. On the other hand, open-angle glaucoma is the most common form of glaucoma and accounts for around 90% of cases worldwide. It is when the trabecular meshwork in front of the drainage canals becomes slowly clogged, and therefore the intraocular pressure slowly rises. There is a wide open angle between the iris and the cornea, which is no different from the healthy physiology, and it takes time to develop, with the symptoms and damage caused not being noticeable. There are many different types of minimally invasive glaucoma surgeries available for open-angle glaucoma, and the XEN gel stent is one of the most recent to be approved for treatment in 2017. The XEN gel stent is a treatment only to be used in patients suffering from mild to moderate open-angle glaucoma. It is a small tube around the length of an eyelash, being 6 millimeters long, with a 45 micron lumen. When inserted into the eye by a preloaded applicator, it becomes soft and flexible as it is made from gelatin that is cross-linked with glutaraldehyde. It helps to lower the intraocular pressure and reduces the risk of vision loss. The XEN is a faster and less invasive than most traditional surgeries, and may be a secondary option if previous surgeries have not been effective in reducing a patient's intraocular pressure. Furthermore, They may even stop a patient from needing to use eye drops to help treat their glaucoma, which is something that patients are not keen to do, as you have to do it every day. The XEN gel stent is placed just under the conjunctiva of the eye, with one end protruding into the anterior chamber. It works by creating a new pathway for excess aqueous humour to drain, with the fluid draining into a small blister known as the bleb. This is under the conjunctiva of the eye. There is a chance that the XEN may become blocked or will need repositioning, but this can be easily rectified through a follow-up procedure. Unfortunately, it is only a treatment, not a cure for glaucoma, as it only slows the condition and will not bring back any vision that has previously been lost. Thanks for listening.